Good morning. Good morning, everybody. Well, good morning, good morning. It is 8 o'clock on a very cloudy, misty, uh, yucky look Saturday morning in South Carolina. Uh, I am super excited to be here this morning. We'll give it a couple of minutes for a few people to maybe hop on and see what's going on. I've been working on changing things. It's been quite an interesting week for me. I've been working on a lot of things in the background to try to see how we can help you this morning. I have a list of questions if I can find them, and we will see how the morning goes. Um, so I've been changing some of my messaging. Good morning. I see a couple people out there. Welcome to the Baffled Brain, Demystifying Dementia. Oh my word, Ava, that's early, girl. I'm so sorry. You can watch it on the replay, you know. I just have to do it when it's the best time in my world. I'm happy to have you here, though. I'm really happy to have you here. So welcome to the Baffled Brain at 5 a.m. Ava, Demystifying Dementia, the weekly hour-long program that will teach you everything you need to know about dementia and what to do next. Today is June the 26th, and this is episode 30. I cannot believe it's episode 30. And I am your host, Lizette Cloete from Think Different Dementia, where we believe everyone deserves reliable dementia education. Dementia is complex, but let's make it simple. So I have a goal for myself. I decided to kind of start to be a little bit more deliberate. So on the Baffled Brain, we want to answer 500 dementia-related questions in 2021 because care partners deserve accessible and reliable answers to their questions. And so far this year, we've answered 284 questions. Do you need yours answered? If you need them answered, I want you to start to email them to me so that I can answer them. Miss Ava, since you're on here and commented, do you have a particular question this morning before I get started with my handy dandy cheat sheet? The purpose of this live stream really is to answer your questions, your particular questions. I'm trying to figure out a way for it to make a way to make it way more accessible for you guys to actually ask me questions. Sometimes, they cannot be, sometimes they're not always easily answered live, so I want people to start emailing me a week ahead of time or whenever they want to, and I'll start to put them into this program and then tag those people afterwards. So I am looking, this program is for you. This program is for you to be able to actually ask me questions live. But in the meantime, I pull some questions off of the website, off of the group, to be able to answer those. So since nobody's asking any questions live right now, I'm going to answer a question that I have on my handy dandy cheat sheet. And here it is. This one was an interesting question. I actually had to think about this a lot. And so this question came from somebody who said, "Hello, I have a serious question and problem, or a serious problem and a question to ask. Does your loved one have a companion? And if so, are they having sex? And or do you allow them to have sex? For example, mine is 83 years old, and she has been diagnosed with dementia and Alzheimer's for 20 years already. And I'm trying to see whether we should allow her to continue or not." So, sex is a touchy subject for a lot of people. People do not want to talk about sex. And so I think this is a very valid question to ask. Sex is something that we do need to think about. Sex is something that is a normal, what in my world would be called an activity of daily living. I'm not saying we do it every day, but sex is something that is vitally important. We were made as sexual beings, and sex is something that gives us intimacy, it gives us pleasure, it gives us all of these benefits. But it is a touchy subject in dementia. And I think there are a lot of different ways that one can answer a question like this, because I think it depends on a lot of different factors. For example, where does the individual live? If the individual is living at home with their spouse of 50 years, then it's an entirely different conversation than if an individual is living in a facility like a nursing facility or an assisted living facility where their spouse is no longer with them, physically with them. I'm not even talking about being widowed or widower and things like that. I'm talking about people being physically together. So say your loved one is in a facility, how do we address sex in that type of a setting? So let's talk about sex. Okay, so mostly I'm going to have a lot of people's attention today, I think. So the question was a serious problem. Does your loved one still have sex, and do you allow them to still have sex? And so let's start with at home. So if you have a husband and a wife that have been living together for 50 years, I think that as you know, as the disease progresses, there is going to come a time when it becomes a little bit harder, because the person who has dementia may not remember that this is their spouse. And so the spouse is going to have to be aware of it. The spouse is going to have to be sensitive to the fact that their person that they've been living with and loved for the past 50 years may not be able to consent anymore. I truly think that consent is something that is a very important thing. There's a particular reason in the law why a child under the age of 16 in most states, in most places, cannot consent to sex, right? Because consent involves higher level thinking processes, and consent involves anticipating secondary consequences of things. So if a person with dementia has lost the capacity, either their consent, they're literally a guardian is in place. If they do not have the decisional capacity to still consent to medical things, legal things, etc., we need to be cautious about whether or not they truly can consent to sex. The person can consent in the moment, right? In the moment when a husband and a wife are at home, they can be consenting in that moment, but then maybe the next day they wake up and they say, well, they feel like maybe they've been abused or neglected, raped or things like that, which can cause a little bit of a problem in the home. So we need to be extremely careful about intimacy and sex with people with dementia. And I'm not saying that there aren't appropriate times for a husband and a wife. I'm just saying we really need to think this through. So that's in a monogamous relationship at home, a husband and a wife. So now let's go over towards a facility, right? An assisted living facility or a nursing home. And this is very very, very touchy subject, because most of the people in those facilities do not have the capacity anymore to make a decisional they don't have decisional capacity, right? So that is a little bit different, and it is it's a very hard subject, and facilities and places really struggle to answer and manage this, because I don't know if you guys are aware of this, but the population that has the highest incidence of ironically sexually transmitted diseases are the elderly, because they don't think, when you're younger, when people are younger and being promiscuous, they are more concerned about preventing pregnancy. So there's more an inclination for there to be a barrier method when people are having sex, right? So barrier methods are effective for sexually transmitted diseases. So in a skilled nursing facility, there is oftentimes rampant sexually transmitted diseases that are never actually spoken about because, it's sex is a touchy subject to talk about in a facility. But in a facility, I think if something like this starts to occur, there are lots of factors that need to be considered. Number one is the person still married. If they are still married, that becomes a very difficult thing for the married partner, the married spouse, who's not living with that person in the nursing home or assisted living or memory care, to be able to work through, because their wife or their husband truly may not recognize them anymore, and they may have no idea that this is my husband or wife of 50 years, right? So it can be a very difficult thing for families to work through. The problem that there is a lot of times is that doors are not locked in facilities like that, and things then just happen, and it can be a situation of there was no consent, which then opens up the door for it to be a rape or an abusive situation. So I think that, this is something that we need to have more open dialogue about. I don't have the answer particular to this question, which was, do you still allow your loved one to have sex? Do you allow them to continue or not? It truly is very situationally dependent. So I know that this wasn't a complete answer, but I just wanted to throw it out there and have people start to think about, you know, their loved one and their husband or their wife in a situation where there is still a desire for intimacy, and how to kind of address it. Miss Ava said, you used to volunteer at a convalescent home. The staff there did not allow sex, but that did not stop them. No, it's not going to stop people. Many people were active and sneaking around. I totally believe that. It's definitely something that happens. It's not something that's spoken about very often, but it does happen. And it freaks the staff out, to be honest. I mean, they don't know how to handle it. It's a very difficult thing to handle, and I know of husband and wife combinations in nursing homes that are still actively having sex, and the staff walk in, and my recommendation is turn around, walk out, shut the door, and shut up. But that's in a nursing home with a husband and a wife. Yes, it is. Sex is very good for people. It would depend, Ava, on the situation. So, Miss Eunice said, why can a loved one be so stubborn a few days before the full moon and after? Eunice, that's a great question. It is really fascinating. It truly, I don't know that there's truly a scientific study or scientific evidence, like true evidence-based stuff that says the full moon affects people. But it does. It absolutely does. I can tell you that when you've worked in a nursing home, in a hospital, in places like this, emergency rooms, the full moon affects people. There are more babies born around a full moon. There are more psychotic breaks, behavioral disturbances come out, all of these sorts of things. But from a practical perspective, I mean, our bodies are like 80-90% water, right? And the moon affects tides. And so that's what I wonder. I wonder if that's part of how the I'm sorry, my cat's walking over my computer and I don't want it to fall off. I wonder if that's why people are having, behavioral changes around a full moon. So I totally know it's a thing. Anybody who works in healthcare will tell you it truly is a thing. Um, just pay attention to it and for it and see, if you can pick up a pattern. Is it always the same behaviors that come out, or are they different behaviors every month? I still believe a behavioral tracker is the best thing that you can do to look at and see whether somebody's having changes in their behavior. Miss Lori, welcome. Happy birthday for the other day, my friend, and I am so glad to have you here. Do you have any particular questions for me today that I can answer about your husband? Anything that's been going on that you'd like to be answered? Miss Ava, do you have any questions? Eunice, do you have any other questions? I welcome your questions. That's what I'm here for, particularly to answer questions on this live stream. So the next question that was on my handy dandy cheat sheet is, howdy, I'm a recent college graduate taking care of my grandmother with dementia. I joined this group in search of some advice. I feel a bit out of place as it seems like I'm one of the youngest, I'm 23-year-old, full-time caregivers in this group as far as I can see. I've been trying to study to apply to dental school, but it's a bit of a challenge to do because I'm constantly worried about her not eating. My grandmother is not eating. My grandmother refuses to eat meals that have nutritional value and will only eat snacks, popcorn, chips, and so on. She's 88 years old and weighs 98 pounds. She recently expressed some aggression towards me and left me in tears. Is there any advice on how I can get to eat more? And this was from Jessica. Jessica, that is a great question. Thank you for asking it. And you're my hero. Like, truly, you are one of my heroes. How wonderful an experience it is to be 23 years old and have the skill set to help take care of your grandmother. It is truly a blessing. I know at 23 that you're not likely going to understand it fully right now, but I am so super, super proud of you for being willing and able to take care of your grandmother. No, you are not alone. You are not the only 23-year-old out here that is taking care of their grandmother. There is a lot of younger people who are stepping up to the plate to take care of their grandparents. I literally worked with a patient this past week. I still work full-time as an occupational therapist in a home health setting, and I have had a patient that I've had the distinct pleasure of working with his grandson over the past year to help him work on the skills he needs to take care of his grandfather as his grandfather is progressing through his dementia. And so he's a little older than you. He's 30 years old, but he has been providing care for his grandfather for several, I think about 5 years now, and he's done a phenomenal job. And so it is hard, but my hat coat goes off to you, young lady, for stepping up to the plate and helping your family, and particularly your grandmother. You will never regret it. Now, as to what you were saying about your grandmother's eating, let's start with that. 98 pounds, baby, is little. That is very, very small. And I know that it is scary. And right now you're worried more about her nutritional value, and I'm really more worried about calories. Whatever she will eat to get in would be great. If you can get things in, like protein, that would be wonderful. Try to sneak them in to things like a smoothie. Try to see if you can make her a smoothie. They make Ensure, Boost, Ensure, all of these nutritional drinks that you can try to see if you can make her a smoothie that you can sneak stuff into. Don't give her huge big glasses of drinks or things. Try to give her lots of little things throughout the day instead of one big meal. If she is willing to eat, sometimes what'll happen, because honestly, from what you're describing at 98 pounds and having trouble eating, your grandmother's probably getting towards the end of her journey with her dementia, and that it is sometimes overwhelming for their brain. If you put a big old plate of food right in front of them, right, it becomes very overwhelming to them. So a few strategies that you can try for some particular reason. If people are having a very hard time eating, a contrasting color plate works, particularly red. So if you can give them a red plate with their food on, but not huge buckets of food, give her little bits of food, and try to have her just eat a little bit, because if it's so much it gets overwhelming and then her brain says so that's one suggestion. The other suggestion is, or the other question I have is, if you give her a spoon or a fork, does she still take it? If she still takes it in her hand, if she still takes the spoon in her hand and she knows what to do with it, that tells me that she's at a certain level in her thinking processes. And that means that she should be able to still feed herself independently. She may need you to literally sit there and people with dementia later on, they lose the ability to complete a task. They can sometimes, with cueing, start the activity, but then they literally forget what they're doing. So if you sit there and say, take a bite, okay, take another bite, Granny, take a sip, take a bite. If she stops, take the spoon, see if you can feed her. So sometimes, as an occupational therapist, my primary function is try to get people as independent as they can be. But there's a tipping point, right? There's like a seesaw, a tipping point. I want her to feed herself as long as she can. If she is not able to feed herself and we need to get calories in, I want you to start to help to feed her. But I always want a person to start with them feeding themselves as much as they can. So I would present the food to her, and so I would give her the red plate, little bits of food on the plate. If she's still taking a spoon, have her feed herself. Sometimes for some people with dementia, they taste sweet things better than they taste the salty and the sour and the bitter stuff. So if you take her food and it grosses people out, but don't be grossed out by it, don't necessarily let her see it, but throw a little bit of sugar or honey or sweetener on her food and mix it in so that it's a little sweeter and not salty, and see if she'll eat that a little bit better because it's sweet. So another strategy that you can try, if that still is too overwhelming for her, giving her a plate with lots of food on, go to little bowls and present her with one little bowl of food at a time. See if she'll eat a few bites. If she stops eating, then you give her a few bites and see if you can get her nutritional status up that way. If she's only weighing 98 pounds, Miss Jessica, if you guys have not started to talk about palliative care, it likely is the right time to start to talk about palliative care. I don't want you to be afraid of this process because unfortunately this is a normal, it's a sad progression, but it is a very normal progression for people when they're going through their stages of dementia. It is very, I hate to say this, but dementia, at least right now, if we start earlier on, there are things that we can do to prevent dementia. I truly believe that. But at your grandmother's phase of dementia, Miss Jessica, she's in a terminal process. This is going to be contributing to her passing away. Whether she dies from dementia or with dementia, I don't know yet because obviously she's still here. But people who are 98 pounds is already at a very low body weight, and so I would beg you, if you are in a position to talk to the people who are the decision makers in your family, because likely at 23 that's not you, I would beg you to talk with your parents, your aunts, uncle, whoever is the decision maker about palliative care. Palliative care and hospice is not brought in soon enough on people at the end of their dementia journey. And it is, especially here in the United States, a very valuable resource that we're not using soon enough. So I would beg you to try these strategies. I've given you several strategies to try. And then I want you to talk to your parents, your people, the decision makers in the group about palliative care for your grandmother, because she is nearing the end of her journey, which is very sad. But the reality is we are all going to die. Every single one of us at 23. I know you don't think that you're going to die one day, but we're going to die. And unfortunately, your grandmother is getting a little closer to the end of her journey. So I want to try to put some support around you, and I want to try and put some support around your family by getting palliative care involved. It'll make it easier for you and your family in this process. So please consider that advice. Thank you for asking the question, and thank you for stepping up to the plate and helping your grandmother. So it is I'm here for you guys. There are a few people out here. Do any of you out here have any particular question? Lori, thank you for telling me you don't have a question. You know, I love answering your questions, and I'm so glad that they took you out for dinner, baby. That sounds like it was so much fun. So I'm asking for you guys to give me some questions. If you're not familiar with me, my name is Lizette Cloete. I'm an occupational therapist. I also have another group called Think Different Dementia, where it is more of an educational group, where once a week on a Thursday night I do a 1 hour educational program on a topic. I pick a program and I develop it out, and then I present it as a program. So if you're not part of the group, I invite you to become a part of the group. Like I said, it's called Think Different Dementia, and I'll throw a link in the comments a little later on. If you are watching this on replay, if you have any particular questions, I'm trying a new thing. I'm trying things, shake it up a little. I want people to try to start emailing me questions a week ahead so I can actually answer your particular questions. And so my email address is thinkdifferentdementia@gmail.com. So if you have particular questions throughout the week, start to email them to me. I'll put them in a document like I've been doing over here, and I'll start to answer those questions live on this program once a week. Excuse me. So the next question I had was from Katie. Katie, thank you for joining us. I know that you're new to this group. I am super glad that you are here. We are here to I'll get to that in a second, Lori. Sorry. I shouldn't read comments while I'm reading a question. Katie's question was, if a person has dementia, does that automatically mean that they are incapacitated? And the answer to the question in a very short statement is no. It is going to depend. It literally is going to depend on where in their dementia journey they are. So Katie, I'll quickly run through some of the different things about dementia, which you might not know yet. So the first thing that we notice, or the first thing that is, depending on which staging tool you're using, there are either 7 stages, which is the functional assessment staging tool, which I use, and then there is the clinical dementia rating score, which is also a different way of scoring people regarding their dementia and staging them, and then just to put them briefly in 4 categories, there's mild cognitive impairment, which literally just means so there's subjective cognitive impairment. I know I'm having trouble thinking, but a test is not going to show that I'm having trouble thinking. But I subjectively feel like something's not right. Never ignore that. That is important. It's a sign that something's going on. Secondly is mild cognitive impairment. Mild cognitive impairment literally just means, and it's a misnomer because it's very incapacitating, I don't mean they're incapacitated, but it's very incapacitating. It can cause multiple problems because what happens in mild cognitive impairment is the stuff that keeps us independent in the community starts to go away, and that's called executive functioning. Things like time management, things like emotional regulation, things like the ability to anticipate secondary consequences of things, all of these higher level things. It influences things like medication management, driving, finances. People get scammed at that time. So mild cognitive impairment just means that tests are starting to show that something's going on. Now, mild cognitive impairment will more likely, unless there are strategies and things put into place, which includes lifestyle changes. Research shows that mild cognitive impairment turns into mild dementia about 20% per year. So over the next 5 years, that person's more likely to go into a mild dementia. Then you have mild dementia, moderate dementia, and severe dementia. So Katie, just depending on where the person that you love is in their dementia journey, they may or may not be incapacitated. Now let's talk about incapacitated, because there are two things, there are two separate things that people need to understand. Incapacitation is actually a legal term. If you have somebody declared incompetent, you've gone to court. Like if I were to step in with my parents and have them declared incompetent, I would have had to go to court to prove that they are incompetent to make their own decisions, because I'm taking their rights away. And the court takes that very seriously. And I would then be turned into their legal guardian. They would have no more rights. They cannot vote, they cannot marry, they can't sign contracts, all of this stuff. So that's the legal definition of incapacitation. Now, and this is one of the reasons I tell people to make sure that when your loved one is diagnosed with dementia, before it becomes so evident to people that something's going on, you need to make sure that their legal financial stuff is set in place. And what I mean by that is you need a will, you need a healthcare power of attorney, and you need a durable power of attorney for financial decisions. Now, the healthcare power of attorney and legal power of attorney can be the same person. In our household, we'd split it up. I'm my parents' medical house, their healthcare power of attorney. My sister is their financial power of attorney. So we split up the responsibilities, but they don't have to be split up. They can be the same person. You do that immediately. Immediately when your loved one is diagnosed with dementia, you make sure they have a will. You make sure these documents are in place. And the reason for that is when they get to the point that it is now evident to everybody around them that, something's really wrong, Houston, we have a problem, right? Now we don't have to go to court because we have a legal document that says, when I'm not able to make my own decisions, Lizette is my healthcare power of attorney, right? Which means that then you go to the doctor and you have two doctors declare them incompetent, and all of a sudden your healthcare power of attorney stands and you don't have to go to court. So incapacitated, like I said, Miss Katie, is a very complex subject. So this was just a brief little, overview of it. I actually I invite people to join my group called Think Different Dementia, because I actually did a whole hour-long program on guardianship in that group a few weeks ago. So if you're new to me, join my group. It's called Think Different Dementia. It is a more educational group. It's not a support group at all. It's an education. It's a supportive group. I don't want you to think it's not supportive, because it is supportive. But the focus of the group is education. So like I said again, Think Different Dementia is the group's name. I'll put the link in the comments later on, and you can join the group and then look for Dementia Made Simple, and then there is a whole group of events that I've done, and the videos are in there. If you have questions moving forward, I invite you to send me an email at thinkdifferentdementia@gmail.com, and I will answer your questions live on this program a week, every week, and I will tag you in the links. And so I see a few people have Oh, so Miss Lori. Lori makes me laugh. I love having Lori on here because, but my problem is our brain is great, right? Our brain can do a lot of things at the same time. And so I can sit here and I can talk to y'all and then I can read a comment and then I laugh. And I'm like, I was reading something here and I was laughing at Lori's comment. So Lori said, I've been moving her husband's arms and legs as I've suggested. That's called passive and active range of motion. He loves it and he smiles. Lori, I'm so glad. Are you taking some scented lotion that he would like, or take some lotion that doesn't have scent? And if you used to wear a perfume that he liked, put a little bit of the perfume in the lotion and rub his arms with the lotion and see if that'll make him smile. Because you know what? Hopeton can still feel, touch, and he can sense your love, and he can smell, and he can see. And so sing to him, baby, sing to him. Rub lotion on him, move his arms and legs. I think you are doing such a good job of supporting your husband in this really very, very difficult time. And I think and pray for you, right? So I'm super excited to always have you here. Miss Cheryl says, I know my mom misses family and friends. What suggestions do I have on ways to encourage others to come see and spend time with her? Cheryl, that is a great question. And I'm going to answer it in a roundabout kind of a way. And I don't think I have it within reach to kind of go over it. I'm going to I'm going to fly by the seat of my pants, which I do a lot. But one of the big things that you're seeing there, Cheryl, is there's a scale called the Caregiver Readiness to Change scale. Okay? And when people are not ready, they're not ready, right? And so with the Caregiver Readiness to Change scale, it's like a 4-point scale. Number 1 is literally just means I don't even know there's a problem. Everybody else, the doctor says mom has dementia. I don't think she's got dementia. Y'all are out of your mind, right? There's nothing you can tell me right now for me to believe that mom has dementia. Number 2 is what they call the pre-contemplative phase. This is where people are starting to say, oh, yeah, maybe there's a problem, but I really don't think there's anything I need to do about it yet. Maybe I'll start to think about changing, but I'm not really super keen about changing yet. I see the problem, but it's really not that big a problem, right, in general. Then the third one is the contemplative phase, right? And that phase is like, ooh, Houston, there's a problem. Oh gosh, I really need to start doing something about this problem, but I don't know what to do. Where do I go? And then the fourth one is when people are like super active, right? It's like, I know there's a problem, kind of like what you were when you reached out to me a few weeks ago, right? I know there's a problem. I know I've got to do something about the problem. What are my options? How do I do it? So when you say your mom misses her family and friends, what I hear is they don't truly understand what's going on yet. They're not at a caregiver readiness to change. Now, when people are in the lower readiness scale, the only thing you can do is you need to educate them about dementia. They don't understand what's going on. And you do that by inviting them to groups like this, inviting them to my group, educating them about dementia and the changes and what the research is saying. I know you've researched a lot, right? What the research says about mom's type of dementia. I'm sorry, you say to them, I'm sorry you don't see what I'm seeing, but this is a reality, and let me educate you as to what, you don't have to say, let me educate you. You find your own way of saying it. Don't be me. There's enough of me to go around. Nobody else needs to be me. You find your own way to talk to people, right? And you start to educate them. Mom has a few years left. Mom is slowly losing her ability to recall things and be active in those things. And if you want to try to frame it, the hard part is your mom's not going to remember Your mom's not going to remember those interactions. Those interactions truly are great for your mom and healthy, and I want her to have those interactions, but she's not going to remember them. Those interactions are for them. If they want to make new memories with your mom, they need to come spend time with them. And to be honest, if there's a way to make them understand that they are losing out opportunities to make new good memories, of opportunities for them to make good memories with your mom, maybe invite them and say, hey, I want to make a book about mom's life, and I want to take some videos of you guys talking, and I want you to ask her questions about when she grew up, and I want to videotape you guys. See if that works, right? There's a lot of just be creative. People need to be creative. We are so afraid of documenting this process for whatever reason, but your mom has, so we'll say your family members, right? Say to them, come to mom's apartment, set up a time, like an appointment. Take your phone with and have a list of questions that you want them to ask your mom, and videotape it and keep those videos. You guys will never regret making these new memories for you to remember. So anyway, I hope that was helpful. It probably wasn't a truly complete answer, but at least, it gives you some ideas. They probably don't understand what's going on, is the thing that I wanted to, bring out. So Miss Ava said, thank you, Katie, for the question. Really answered a lot of questions you have. You're in that planning phase. So Miss Ava, let me know if there's anything I can do to help. If you're not part of my group, which I think you are, Think Different Dementia, please join and go watch the program on the guardianship, and the difference between guardianship and healthcare power of attorney. So Lori said, good idea. Now you'll bring lotion. I hope you had a very good perfume or some scent that was yours, that would trigger his. So the great thing about the brain, even though we forget stuff with dementia, as it's going through that process, part of our memories are what we call episodic, right? And so that's the stuff that we go to, the emotions, right? So oftentimes people ask, why is somebody always crying, right? Or why, because sometimes they're in an episodic, their brain has gone back to something that was really emotional. Like, we have an emotional connection to memory. Think about your wedding. Okay, let's find some happies. Think about a good time. When you got married, right? A really super happy day for you. You have certain emotions that go with that. If we can tap into those good emotions with people, and smell is one of them, Lori. So if you can use smell, that would be super great. Sound of voices, singing, things like that can also bring up episodic memories. Miss Eunice said, do I think it's okay that a loved one can do paint by numbers with dementia and Parkinson's? Absolutely. To get them out of doors in the sun, yes. Absolutely, and TV sucks. I hate TV. I think it's terrible. We think people are watching TV. They're not watching TV. The TV's on for the staff. The TV's on for everybody around them. They are not actively watching television. Television is a brain dead activity. Do I use television for myself? Absolutely. But yes. So Eunice, here's the thing about those three things that you said. Paint by numbers, I think it's great for dementia and Parkinson's. Remember, the goal behind the activity is participation and engagement. It's not the result. It's not how pretty it looks. It's not, can I put it up on a wall? It's not any of those things. And if the paint by numbers is too hard, then notch it down, right? Give them, paint by numbers sometimes has lots of little spaces. And so if we have Parkinson's and we're shaking, and it might be hard for them to paint in those small little spaces, get a coloring book, and you put in the numbers, something that's bigger, and then have them color it with a crayon maybe. So that's a way to make a paint by numbers easier. So remember, the goal of participation, in an activity is always engagement. It is never end product. Especially, well, I shouldn't say that. That's not entirely true either. Earlier on in dementia, people still have a concept of an end product, and then quality can still be a part of it. But if a person doesn't have a concept anymore that there is an end product, that I'm working towards a particular thing, then the goal of the activity is to engage them in the activity. It's not what the activity looks like at the end, right? Why is getting people outside in the sun so important? So we just this past Thursday night on my program in Think Different Dementia, which I call Dementia Made Simple, because dementia is complex, but we can make it simple. We actually talked about sleep. So here's the thing about the sun. Sun resets our brain. We have a circadian rhythm that keeps us on track every day, okay? And the sun, going out in the sun and the sun hitting our eyes, and the vitamin D from the sun helps to reset our brain and say, okay, it's day. So what happens, one of my biggest pet peeves, like truly, I have a few pet peeves, this is one of them. I'll go to patients and I'll walk into the house. I'm an occupational therapist. I'll walk into their house and it looks like night. It's dark, all the blinds are shut, TV's on, person with dementia sitting like this in front of the TV, right? And then the person who's their loved one, the care provider, the person who is helping this person with dementia, says, they won't sleep at night. I'm like, no kidding. Why won't they sleep at night? Let's open the blinds, people. And I literally will say to them, I'm like, but it looks like nighttime here right now. If you open the blinds and bring in the light, we can start to set their circadian rhythm back again. Because if they're sleeping the whole entire day on the couch, then why on earth would they sleep at night, right? So people get their days and nights flipped over then, because they don't need more than a certain amount of sleep per day. And then white and woolly and walking around the whole entire night, and the family doesn't understand why that happens. I'm like, because your house is dark. It looks like it's nighttime right now, right? So getting people outside in the sun is vitally important. So there are a few things that can really help people with dementia sleep. Diet, exercise. And exercise doesn't need to be hard. It can be walking, just walking outside around a block, or just walking up and down the driveway a couple of times, getting them outside in the sunlight. Diet, exercise, sleep, right? A good sleep routine, good sleep hygiene. What does that mean? Get up every day at the same time, go to bed every day at the same time, go outside in the sun, lots of other things. Go join Think Different Dementia and watch the video. And if you need me to send it to you, I will. And stress, so keeping people's stress levels down. So those are some strategies, Eunice. I hope that was helpful. Does anybody on here live still have a question for me right now? We have about 10 minutes, a little more than 10 minutes. And yet again, if you don't know me, my name is Lizette Cloete. I'm an occupational therapist. I do this once a week to try to, I have a new goal for myself. I'm changing things around because I really want to help you guys. So my goal for myself is on the Baffled Brain, Demystifying Dementia. Over this next year, we will answer 500 dementia-related questions in 2021 because care partners deserve reliable and accessible answers to their questions. So far this year, I've actually answered, and they weren't all in this forum, but I've answered about 284 questions. If you need your questions answered, I want you to email me, Lizette, okay, that's me. I want you to email me at thinkdifferentdementia@gmail.com, and so I can answer it live in this program next week. So those are some ways that you can connect with me. Another way you can connect with me is you can subscribe to my YouTube channel called Think Different Dementia. I'm slowly working on growing that. It's not really my focus right now. I would love to invite you guys to join the group. It's an educational group. It's a supportive educational group. It's not a support group. And so unless anybody has a question, I'm going to answer another one from my sheet. So here we go. This is from Mike, my loved one, and I always love this. Mike does such a good job of always saying this. He says, my 67-year young wife, living with dementia for 6+ years, has gotten more difficult when I help her to get undressed and into her nightgown at bedtime, and the reverse in the morning. What tips or tricks do you use with your loved one that may help? So, Mike, your 60-year young wife living with dementia for 6 years. So, just off of that description, I know she's probably in the getting moderate to severe phase. Is getting harder and harder to get her dressed and undressed at nighttime, at bedtime, right? And the reverse in the morning. So, how do we? A few things that come out is I want to ask you a question. Why is it important to get dressed and undressed every day? Can we look at simplifying the activity? Can we look at simplifying the task? And what I mean by that is, if it's starting to become a battle to dress and undress and get in a nightgown, can we start to switch and start wearing clothes that are more comfortable, that you can wear all day and only change once? Right? So what I mean by that is, can we switch to start wearing sweatpants and a sweat top, or sweatpants and a t-shirt, and have her just sleep in those at night instead of trying to change her? So that is a strategy you could try. If you're not ready for that strategy, I would guess, and this is just a guess, Mike, but I've been doing this for 30 years. I'm pretty good at what I do. I would guess you may be asking her, do you want to change? Right? So if you're asking a direct question and she says no, you got a problem. Honey, do you want to get into your nightgown? No. Okay, what now? Right? Now you got to fight because you want her to do something and she doesn't want to do it. So sometimes just changing our wording with a person with dementia and making it more a statement and not a question, and I do it so spontaneously that I don't even think about it anymore, but saying things like, here, it's time to put this on, right? Instead of saying, do you want to put your nightgown on? Here, it's time to put this on. Let me help you take this off, right? And not say things like, do you want to put your nightgown on? Here, let me help you take this off. How about we just pull your arm out of the sleeve? You know, if she says, no, I don't want you to help me. Okay, just pull your arm out of the sleeve. She might not be at a point anymore where she can sequence herself out of the activity, and you. So oftentimes what happens with caregivers and loved ones with dementia is that there's a disparity between the care provider, the care partner, you may think she's here and her abilities are here. So you may be overestimating a little bit what she's able to do, and thinking that if you just say, take her, let's change, that she knows what to do. So you may want to try a couple of different strategies and see what works for you. So Mike, if none of those strategies work, I invite you to contact me. I do consulting on the side as well. So if anybody needs more individualized assistance, I'm welcome to set up a more formal agreement and help you that way. So there you go, Mr. Mike. I hope that was helpful. Mahesan. I hope I didn't butcher that too much. Mahesan, that's beautiful. Is there a medication to slow down the progression of dementia? That is a great question. So I come from a little bit of a different perspective. If you're not familiar with me, I come from a little bit more of a holistic perspective regarding dementia and dementia progression. So here are a few things that you know, and this is the reason my group is named Think Different Dementia, because I really want people to think differently about dementia. So I invite you to join my Facebook group as well. So dementia dementia is one of my biggest frustrations is the fact that the medical model, there are different models. There are different models out there. The medical model says dementia is, there's nothing we can do to prevent dementia. And there is a holistic functional medicine that is starting to show that there are things that we can do to prevent dementia. Dementia is something that is becoming more common, and if you start to look at what causes, if you get out of the medical model and you start to look at some of the underlying root causes of disease in general, not just talking about dementia, I'm talking about diabetes, I'm talking about cancer, I'm talking about Alzheimer's, dementia, I'm talking about Parkinson's disease. There are all of these, a lot of diseases, if you start to look at the root causes of diseases, have lifestyle and things like infection, inflammation, blood sugar, diet, exercise, sleep, habits, in common that have caused disease in general. And dementia is one of those. And so there's a book called The End of Alzheimer's, Maheson, The End of Alzheimer's, written by a doctor called Dale Bredesen, that goes into he has shown that there are up to probably more 36, I don't remember if it's 36 or 38, but in the 30s, different contributing factors to dementia. Things like inflammation, things like blood sugar, things like all of these different things, right? And so medication is a monotherapy. So think about needing an antibiotic, right? So you have an infection, say a urinary tract infection that is caused by E. coli, and we can test your blood and say you have an infection, or your pee that says you have E. coli in your urine. An antibiotic that is effective to E. coli is a monotherapy that treats it. Boom, right? Dementia is not something that a monotherapy, which is what a medication is going to stop. It's not. It plugs one of the holes. It can slow down the progression of dementia. There are a few that have been approved. There is a brand spanking new one that's come out that costs $56,000 to use. We don't even know if there's really no research to show whether or not it's effective, but it's been approved. It costs almost $60,000 for 1 year of medication. It takes 2 years before you can see whether it's effective or not. That's $112,000. How much help? How many caregiver hours? How much help can we provide people in their home for that medication that nobody knows is going to work or not? And I think that's really, anyway, that was my little soapbox. But I will tell you, Maheson, I'm not suggesting that people don't go on medication for dementia. That is not what I'm suggesting, because I do think that medication can play a role. But the research also shows that medication is only effective about 2 to 3 years. I think maybe somebody said it was 5 years. I cannot remember. We have a nurse practitioner that comes on every now and then. But I would say, 2 to 3 years after medication stops to be effective. And medication, in my opinion, is way more effective at the beginning. The medications that are specific to slowing it down is more effective at the beginning. Then there are medications that are effective when people start to have behavioral changes. The caveat that I'm going to give you is almost every, if you really read side effects of medication, you will find that often, frequently medication, and I'm talking about blood pressure medicines, I'm talking about every medication, almost every medication, somewhere deep down in the list may have increase cognitive impairment, and actually some of the dementia medications can have that side effect. And so I'm not saying don't use medicine, and I'm definitely not saying take somebody off of medicine if a doctor has prescribed it, but I will say we need to be way more cautious about giving people medication. I really believe that. I think I truly know medication plays a role, and I am a proponent for it being used effectively and sparingly. But I also know, and I've seen this numerous times, when people are on palliative care and so on, we get put on, I'm 50, we get put on medication in our 50s because all of a sudden we're having blood pressure, well, whatever, right? And nobody takes us off of those medicines, and we're still on them at 90, and we may not need them anymore. So oftentimes at the end of people's lives, they start to take people off of medication they've been on for years and years and years, and all of a sudden some of their cognition clears back up again. I'm not saying it goes all the way back to normal, but there definitely is a change in their cognitive ability sometimes when we take people off of medicine. Medicine is not benign, and we have a tendency of believing just because the FDA or whatever says that medication has been approved for something, that it is benign. It is not. Every medicine has a side effect. And so that was my little soapbox for the day. So Mahesan, please join my group. I hope you join it, and I am glad you are here. Ava said, I know somebody that makes clothing easier to get into. The tops were cut straight up the back and buttons added. That way everything comes on and off like a hospital gown. Yes, that is certainly true. There are lots of adapted clothing online that you can look at, but whatever strategies we can use to make it a little easier can also be used. So if you are watching this on replay, just throw replay. Thank you guys for joining me live today. This was the Baffled Brain, Demystifying Dementia, because we know that dementia is complex and time-consuming, and I want you guys to be able to find accessible and reliable information quickly and easy. So this was my 1 hour long program that brings you an accessible place to ask your dementia-related questions, because all caregivers or care providers deserve reliable answers to prevent burnout and improve their quality of life. Dementia is complex, but we can make it simple. So I invite you guys to join my group. My name is Lizette Cloete. I'm an occupational therapist, and as I end all of my programs every week, the Lord bless you and keep you, and please join me again next week, and thank you for being here today. Bye.